Hey guys, I'm Dr. Miriam, family nurse practitioner. I have been in the healthcare field for 20 years, and I have been a nurse practitioner for 10 and working with kiddos that experience autism for the last 3 of those. We are going to be doing our first in a series of Ask Dr. Miriam, where I answer the questions that you guys have sent me, and let's get to it. Everything I do in my work and the work that I do with adults and kiddos is the understanding that we were never broken. Your kids weren't broken, you aren't broken. And from that standpoint, then I look at what is happening as a sign of what the body is trying to tell us. So we look at the whole person and not just a behavior or a symptom, and we say, oh, that. We look at the whole part to say, what are the tests? What's happening in the body? What's happening, at home? What's stress? Everything that could contribute to how you are showing up, to how your kiddo is showing up. And that makes the biggest difference and the biggest changes when we look at the whole picture and not just one symptom.
My kid has constant tummy trouble, constipation, super picky eating. Is that connected to autism or totally separate?
Oh no, that's very connected. So, picky eating, gut issues, constipation, they are all very common presentations that come under the umbrella of what is autism, because autism isn't one thing. It is a conglomerate or a multitude of different experiences that the kid is going through, that there are certain things that are like, oh yeah, that's more consistent. Constipation, very, very common. Picky eating, but here's the thing. So it's consistent with autism. What I want people to understand is just because it's consistent with autism doesn't mean it's not consistent with being a kid. Kiddos that experience autism, they will understand you in a different way perhaps than a neurotypical child. So they look at what you're doing as attention, as energy. And so whereas with a neurotypical child, you can explain in a deeper way what's happening or what you want, with them, it has to be done more through your body language, through the things you do or don't do. That is how they understand the world. And so, but they're still kids. They're still, if I as a kid could eat pizza and French fries and a chocolate muffin for breakfast every day, I totally would have. Your kid is no different. It's just that they're a little more stubborn, they're a little more picky, but the more you give in, the more that's what they're gonna want. And most of the tummy troubles, most of the gut issues that I see when it comes to constipation, the parents also go, and they're really picky eaters. They only eat like French fries, pasta, and whatever other carb that makes them very constipated. So it is very common, and we have to look at the whole picture to look at what's really driving the constipation or what's really driving the tummy issue. But that tummy issue alone can lead to a whole host of other behavior issues, sleep issues, because nobody likes to be constipated. That alone can lead to a whole bunch of other things. So yes, it's autism and it's kids.
Did Tylenol in pregnancy cause my child's autism? I feel so guilty.
I don't think that it's easy. It's so easy to say as take Tylenol, get autism. Like, we can't say that. When we look at autism as a whole, there's a lot of environmental factors that are leading to why your kid potentially has, the biggest issue or the challenge is detoxing. From that place, then it's the gut issues and it's the neuro or brain inflammation. There's a lot of factors. And so as much as I think, the drive for this question around Tylenol is that parents want an answer. Parents are like, I want to know that this is the thing that caused it, when it's actually this like multifactorial challenge that the body is undergoing, that we can't just say one thing caused the whole issue. And I'm gonna say this, mom guilt with moms that have kids that experience autism, mom guilt is huge. So I'm gonna start by saying, get rid of mom guilt. Like, it is so beyond your control as to whether or not your kiddo experienced autism. There's a greater thing, the greater process at play, that you do the best you can with the information that you have. And so I would say right now there is no direct correlation. Could there be like causation, or there's no direct cause, but there could be correlation. That could there be things that people see, like maybe a chemical or a this or a that in the product that could potentially lead to? Yes. But there's a lot of things that could potentially lead to. So we can't say that Tylenol causes autism. Don't beat yourself up if you took Tylenol, because most of us did in our pregnancies, and you do the best you can with the information you have at the moment that you have it. And that's it.
I saw leucovorin was an autism breakthrough. Then I saw it got walked back. What's the real story?
Leucovorin, I think, was one of the biggest misses right now in the autism world, because I hear it time and time again that people are saying, oh, my pediatrician, I've seen, providers, there was recently a neurologist I saw on TikTok or Instagram that was like, yeah, there's no evidence, there's not enough evidence to support this. And that tends to be the same rhetoric across the board. There's not enough evidence. It can cause side effects. And here's the thing, 90 to 95% of my practice is on leucovorin. And there is a reason, because for the majority of those, it works. The misconception, which is where most of I started jumping on TikTok to actually start educating, was when it was said that it is a cure for autism. That is a misconception. It is not a cure. Is there a deficiency that B9, which is leucovorin, it's folinic acid, that B9 is filling a deficiency in the cells in the brain that need folate to properly function? Yes. And do I find that with the vast majority of my kids? Yes. Even the ones, and you'll hear about the FRAT test, that is an antibody blocking the ability to use folate. Even if that's negative, there's still mitochondrial dysfunction. The battery of the cell cannot properly function, therefore it cannot properly take up even food sources. And so I do find that even those kids, I do a trial and I get improvements, and people will say, well, there's negative side effects. Yeah, but there's negative side effects to Abilify, to Adderall, to all these really strong meds that, to me, if I'm missing a vitamin deficiency over those meds, I'm missing a big piece. I have seen self-injurious behaviors go down. I have seen improvements in sleep. I have seen improvements in speech. I have seen improvements in behaviors, alertness. I've seen too many things for me not to use it or not to even try to use it. So to me, there is evidence. To me, there is reason to support it. And to me, if we're missing that, it goes back to the root cause. I can put all this stuff on, but if I've missed a vitamin deficiency, I've missed the whole point.
My child is nonverbal. Is there any hope for speech?
Nonverbal is not kids that are nonverbal that experience autism. There are some things that can be done, but there's never a guarantee. So have I seen improvements in speech with using things like leucovorin? Yes. I think ultimately for any kid, but especially if they're nonverbal, the first place I start is make sure they're on a really good multivitamin. Make sure we're supporting the foundation. Start looking at, gut testing, toxin testing, because if their system is overloaded and it has toxins and their gut can't function well, their brain can't function well, we're missing big pieces. Beyond that, then there are, medicinal signaling cells that have shown, improvements. Nothing is meant to necessarily fix what we're trying to improve. The other factor is the behavior aspect of it. So as someone who does telepathy with kids with autism, I have spoken to enough kids that they're like, yeah, that language thing, that's so boring. We'd rather just do this. And I was like, do what? They're like, do this form of communication that we're doing right now, this talking. And I was like, do your parents know that you're doing it? And they're like, well, yeah, they get it, but their mind gets in the way and thinks that they're not hearing us or feeling the emotions. And so they doubt it. And I'm like, okay, well, that's great, but not everybody understands that. The thing is that's important to understand is these kids being so connected to spiritual selves, they are communicating all the time in a language we forgot we actually speak, which is essentially, people will say, I don't know, I believe in telepathy. Well, you believe in Wi-Fi, don't you? Telepathy is a Wi-Fi signal, but it's our bodies that are the Wi-Fi signal. And so I have found that those that are nonverbal, and if you listen to Telepathy Tapes podcast, they say something similar. Those that are nonverbal tend to be the ones that use telepathy all the time. And so there's a spiritual aspect to this whole thing. That's the idea of looking at the whole picture, is that there's a very big spiritual aspect to this whole thing. Beyond that though, there is an aspect that kids that experience autism tend to be a little bit lazier. They're like, why would I want to use language when I can use telepathy. I can point, I can basically get what I need just by getting my parents to do what I want. And a lot of parents know what their kid needs before the kid says anything. So if the goal is to get more speech, you also got to look at the behavior. Medicinal signaling cells have shown to have improvements. Leucovorin has shown to have improvements. Detoxing has shown to have improvements, but none of those are guarantees. And part of that is the behavior and whether your kid actually wants to use language or doesn't, and how much are you encouraging. So this is again multifactorial. It's spirit, it's body, and it's behavior.
My son was just diagnosed, and within a week, everyone's telling me he needs 30+ hours of ABA. Something in my gut is screaming no, but I'm terrified that if I don't do it, I'm failing him. What would you do if he were yours?
I very much am gonna start by saying if your gut is saying no, then that is the no. I think, and I see this more and more in parents with kiddos that are autistic, but moms especially, because we are so intuitive, we are so connected to our kids. And I think if your intuition for any of us is saying no, or saying find a different way, or find a different route, then find that different way and find that different route, because your intuitive self is your direct connection to spirit, to soul side. So that is telling you more than anything on the outside could tell you. So I would say not to look at it as, oh, well, then I'm never gonna do ABA, but maybe it's not that center. Maybe it's not as many hours. You know, there are a lot of things that can be done also. Have I seen ABA centers where they have really good therapists, really dedicated therapists, and it helps parents understand that how to work with their kids and how to help their kids understand what it is that you want in a way that they understand, which is different than a neurotypical child. Not good or bad, it's just different. And so the same way you approach a neurotypical child doesn't always work with a kiddo on the spectrum. And so are there those centers? Yes. Are there centers like with anything else that maybe the way that they're teaching or the way that they, the therapists that are working with your kids there are just looking at behavior and saying, oh, this is just behavior, just behavior, just behavior. And there's more to it, and maybe that's where your gut's saying no, then I would listen to that, because not all medical provider, not all nurses, not all firemen, it doesn't matter the position, not everyone is the same. And so in this case, if you're spending that long at a center, you wanna make sure it's a really good center, because I've also seen the kids that come and they're taught a very like black and white way of being, and none of us are black and white. There's so much gray. And so I see when the specialist that we have in our office, Cece, our communication specialist, she will sometimes approach them and say, hey, maybe we try this way, or maybe we try this way. She understands ABA, but she sees the family dynamic. And sometimes when things aren't working, she gives other ways. So I would say, if the center is a really good center, and you've had good reviews, and you parents have said they've had good outcomes, it's a place to start. But does it have to be 30 or 40? Not necessarily. If your gut's saying no, then don't do that. But look into other interventions. I know when it's a new diagnosis, it's kind of like, I have no idea where to go or what to do. Look at diet. Look at supplements. Are they on a really good vitamin? Are they on a really good fish oil? What are you feeding them? Like, what goes in their mouth is that much more important because of the neurosensitivity, because of the neuroinflammation. What are they watching? You know, we have a lot of kids that are very sensitive to the energy and the input that is from like an iPad or TVs, like they're overstimulatory. And so I recommend parents do things like look at gamma waves online, look at the Schumann frequency. Those are all frequencies, that we're all frequencies. Your kids are very sensitive to frequencies, so you can play those in the background. There's a lot of things you can do that address the whole picture, and then the behavior is one. But don't miss the others just because so many say, well, autism is just a behavior, because it's not. But there's a lot more to it. So I would look at the whole picture.
Is there anything before or during pregnancy that lowers autism risk?
On the idea of things that you can do preconception or before pregnancy, there's a whole nother video, so do take a look at that one as well. I would say, so some of the research I've recently been diving into, I have started to see some greater correlations with studies that were done out of Johns Hopkins and greater studies on the biochemistry of our bodies and the processing of folic acid. So there are studies, there's a study out of Johns Hopkins that shows that folic acid may increase the risk of autism by 2 to 3 times. When we look at how much we consume, there's a lot to consider, and so that's a bold statement, but there's a lot to consider in folic acid. And but one of the things is basically that we have so much in our food supply, we have so many in the vitamins that we're taking, that anything that gets unmetabolized is blocking the ability of folate to be used properly by our bodies and then by the bodies and the brain of a growing baby. From that standpoint, there's a whole host of issues that happen afterwards that when I looked at them and we track them back, they come from a lack of ability to access folate. So my recommendation on that, just this is surface level, my recommendation is to always choose a methylated form of the vitamin. Methyl, B complex, methyl, cobalamin, things of that nature, methylated 5-methyl tetrahydrofolate. That's what you can look for prenatally, pre-conception, because you should be taking something like that before you even get pregnant. Prior to that, even though, looking at a diet that you're eliminating or minimizing the fortified foods that have folic acid. Looking at overall what people say is like a whole foods diet, like focus on less processed packaged foods that have the colors and the dyes and the chemicals that your body, it goes in your body, and your body's like, I have no idea what to do with this. And they build up in your body. When your baby is in utero, they are being exposed to the same toxins. I have done testing on kids, and how do I have 2 and 3 and 4-year-olds with 40 to 50 toxins? It doesn't come from their exposure. It comes from mom, baby in utero. It can come from even mom, like your mother's exposure to these chemicals that you just never knew that you were supposed to or could get rid of them by doing, by eating properly, by potentially doing detox, by supplementing properly. So I would say then from that very standpoint then is look at your diet, look at what you're putting in your body. Also then look at potentially the option of doing detox, of getting your own gut checked, of looking at those two to clear through. I did my own toxins, and I love coffee and peanut butter, and the highest thing in my body was aflatoxin. Aflatoxin is a toxin found, it's a mold found in coffee and peanut butter. And I had very high levels. I just did my daughter's. She has high levels also. She's 7 now. But I'm just saying that there are correlations, and I've done testing with kids and moms, and 50% of the toxins correlated in the kid who was 3 and the mom. And so there is in utero transfer. And so this isn't meant to scare, this is meant to bring awareness to things that we can do. Because when I have a mom look at me who has a kid that has autism and say, what could I do differently? Or what could I have done differently? Or what can we do differently moving forward? None of this is about blame. It's about awareness. And me as a provider trying to say, okay, what are the things we can look at? What can we do differently? And those are some. Look at your own detox, look at your own gut, look at the food you're putting in. Are you getting movement, even walking? Like, are you taking care of the vessel that grows the baby? Those are probably the most important things you can do. And then from that standpoint, watch your supplements as well. There's been so many questions from a previous video I've posted on folic acid and the buildup of unmethylated folic acid in the body and what it causes to a growing baby, what it causes to your own body. So I have some guides that I created. One is a prenatal guide that talks about not only like the vitamins that I prefer, but it goes into like, why is it important to look at B6? Why is it important to look at B12 in the form that it's in? Why is it important to look at the B9 and the form that it's in? So I explain what's in there and what you should look for in the vitamin and why. And then I also give you a list of the ones that I prefer and why. And then I also give you like a shopping list. Like, these are the things you want. If you're gonna go to the grocery store, you take a picture of it. These are the things you want. Or if you're gonna go online, like, this is what you wanna look for. So it makes it super easy. And then I also created a guide that talks about folic acid. It talks about folic acid in your food. So it's a guide that goes in and gives you more information, because a lot of you, this is information, but you need to go to your own provider and have a conversation. This gives you more understanding to go to them and talk to them. And there's more guides coming to go deeper into this. But the amount of folic acid we have in our food supply is more than enough for what our body needs. But if you don't know what's in your food, then you don't realize how much you're actually taking in, and you don't realize how much that could be contributing potentially to increasing the risk of having or experiencing a kiddo that experiences autism. So correlation, not causation, but if I can change one thing and it's super easy and I can encourage like whole foods diet, then why wouldn't I? And that's where I'm coming from. Thank you all for the questions that you sent in. It's always nice to know what information people are wanting and to be able to provide those answers for you. And so I appreciate everybody that sent in questions. If you have questions or comments, leave them down below. If you want me to answer something, leave it in the comments, send me a message. I will make sure that on the next series, I answer your questions. And don't forget, in my bio, there are access to my guides, my website, and all the information on how I work with patients and how you can get in touch with me.